Hi friends, I'm Joel John from Joel John J YouTube channel. And for those who are listening to the podcast and for YouTube people, have a podcast as well, which is named as Joel John J YouTube channel. This is my podcast name, which is given by Anchor FM and it's also available on Spotify. So you can check for my podcast by typing as Joel John J YouTube channel. And what the problem you will be having is as I am giving this as a as for my mainly for my YouTube channel viewers. When you are on a on a cab or something, when you feel hard to see the video as well, and on those times you can listen to this audio using the podcast. Otherwise, I will always recommend you to get into Joel John the YouTube channel to see the video so that you will be able to see the details over there. Other videos I will be trying to record the audio alone and post it on podcast. Those things, videos which I explain on those things will be more good on audios as well. But this video is for as per many of my YouTube viewers request, as people from other countries are also watching my videos, mainly medical billing videos, and they said that my English accent is a little bit different, and they are feeling hard to understand that. I never thought that people from other countries will be doing this process. There are people in European region who are working for US medical billing. That's a very new information for me itself. I thought India, Indonesia, like the developing countries will be doing that, and people on European region are also working on that, and even people on US who work on that are also sometimes contacting me on WhatsApp and saying that you have to work on your accent, and some of the comments you can see it on the YouTube itself. So for them, I will also try to speak in a neutral English, as well as I will show this on a PDF format, so that you can look at the screen and take notes. Apart from these notes, I will give my own explanation as well. And as usual, press the thumbs up icon below the video if you're watching on YouTube channel, and broadcast people share the link. And in YouTube also, press the share icon and share it on all your social media. Mainly send it to your work colleagues on WhatsApp or something, some of the social media which you're comfortable with. Mostly you'll be having WhatsApp groups, right? And start having a conversation on these topics. Take this as an constant uh, initiator for a conversation, and speak more on job related topics so that your fluency will increase. That will show you as a knowledgeable person during the interview and increase the chance of you getting selected. I know most of you will be on AR calling or AP calling, but still watch these videos as well. This will give you more idea when they take across the they have a cross floor work culture in many companies. When they have a shortage, they will hire from AR calling team to prior authorization or to insurance verification, and in AP calling from prior authorization to core AP calling jobs, or into insurance verification, like that. So if you know other details of other process as well, it's always good for you. So now we are going to look at the topic credentialing in US medical billing. What is this? I will just give a short explanation of that. So US medical healthcare practitioner should do this credentialing process in order to enroll them with the insurance company. And for this, there are a lot of guidelines given by the US Department of Health and Human Services. Okay, so what will happen if this is not done? You will get the denial codes like reason code will be B7. The provider was not certified or eligible to be paid for this procedure service on this date of service. So on that date of service, if credentialing is not done to that particular provider, he will not receive any payment. And the remark code is 7 sorry N570 missing, incomplete or invalid credentialing data. So because of that also, you may get your the because the provider is not enrolled, or the credentialing is not done. Because of that, the insurance payment won't be realized. There are also other benefits. We'll start looking into it detail. So now, credentialing in US medical billing. The US Department of Health and Human Services definition for credentialing as the process of assessing and confirming the qualification of a licensed or certified healthcare practitioner. The credentialing is an essential process that healthcare organization and practices must perform to ensure those providing services are qualified to do so. The credentialing process validates that a physician meets standards for delivering clinical care, wherein the payer verifies the physician's education, license, experience, certifications, affiliations, malpractices, any adverse clinical occurrence, and training. So these are the details which during the credentialing process, the insurance company is going to get the details, also to submit the documents, do a background verification, and ensure that this particular practitioner is qualified to perform the role. So this is also safety for the patient. This is safety for the patient as well. There are a lot of people who put fake boards, and sometimes they will be caught by the police. But before that, if you go to a hospital which is approves your cashless card, then definitely that particular partition should have done the credentialing. Indirectly, insurance has a lot of benefits. I used to say that. If you are you getting a proper treatment, are it based on the guidelines provided by the government, or the practitioner that the doctor is giving over treatment and overcharging you? Everything will come to light if you have an insurance policy. That's a real benefit of insurance. Who will come and check the doctor's bill? You need a doctor for that, or you need someone who has given the code and roles of practices. It's all done. But some medical practitioners, they do malpractices when you pay cash. So get an insurance card and go cashless. Okay. Now, the three primary phases of provider credentialing are as follows. One is gather information. A healthcare facility or healthcare insurance plan asks the provider for information on his or her background, license, education, etc. Checks the information, award the provider with credentials. So they get the information, then they check the information as well. That is a very important point. Okay. Now, how many days does it take to complete the credentialing process? Usually, it takes from 90 to 180 days. A standard credentialing process takes from 90 to 180 days based on the guidelines. In some cases, the process may be completed within 90 days, and sometimes it can take more than 120 days. Keep in mind the complexity in medical credentialing. It is best to hire experts in this field. So that's a suggestion for getting credentialing. You can hire an expert for your support if you are a practitioner. The credentialing process involves healthcare organizations, hospitals, and insurance networks accessing and confirming the qualification of a physician or any other healthcare professional. This process is important for everyone, including the facility, the practitioner, and the patients, ensuring that those providing care are qualified for the job. So this is I told you, right, the another benefit of insurance. Whether the practitioners, the medical practitioners, are over-treating you and getting you overpaid from you. So that shouldn't be done. So that will be taken care by, that could be taken care by only by a person who has enough medical knowledge and expertise. So when you have a insurance and go cashless, that is also taken care by the insurance company. Why credentialing is needed? Physician credentialing is a mandatory process, but it's also very important. Here's why. Improves patient trust in the physician, lowers any risk of medical errors, prevent the healthcare facility from losing revenue, provide physician and facility business, fewer restrictions by insurance companies on pre-existing conditions, improved practitioner reputation, increases cost saving, protect healthcare facility from potential lawsuits, physician credentialing checklist. So these are the benefits. They listed some 10 benefits. So go through that clearly. So then comes the physician credentialing checklist. The first step in the physician credentialing checklist is to learn about the regulation in that state in USA. In USA, this credentialing checklist condition varies from state to state. So when you hire an expert, if you are a practitioner, You should also check whether that particular company or the people they have hired to do the job has experience on doing the process on that particular state, because rules varies from state to state. They may be getting into trouble because of that. I'm sorry, because of that as well. So the process can take anytime between 90 to 150 days to complete. When physician credentialing is required before starting a new job, it is recommended to get started as early as possible. The most important step in the process are as follows. The first one will be submitting a pre-application. So based on the healthcare facility or insurance network, it may be required to submit a pre-application. This step is used to vet out doctors that may not be qualified and eligible for credentialing. If they are not eligible, that they are not qualified for that particular task, or if that institution is not, where they studied is not qualified, all those things should be rolled out by this credentialing test. So you are mostly on a very safe hands. In the pre-application stage itself, they remove all those weed out. That means they are when you shed the grains, the weeds, the outer cover of the grains will move away and you will get the grain alone. So that's the process. That's called as weeding out. It is basically a background check that covers areas such as criminal records, any records of disciplinary action, board certification. If you are qualified, you will not have any issues in this process. And approval means you can move to the next step, then submitting the application. When it comes to the official application, you will be required to provide all the necessary information supported by documents and signed forms. The most important physician credentialing checklist of the information is as follows: educational history and transcripts, current medical license, DEA registration and board certification, work history, evidence in continual malpractice coverage. That is, malpractice coverage is a professional indemnity insurance. If he has that coverage, if he does any mistakes because of ignorance, or because of anybody can do mistakes, like because of that some problem comes, this insurance will pay the amount, even if the insurance doesn't pay. If they are, the insurance will pay and get this amount from the malpractice coverage. So that's the evidence for continual malpractice coverage. When you go to renew your vehicle RC, you will be showing evidence for your continuing insurance, right? Something similar to that. Professional immunization records, that is there will be certain vaccination which has to be done for the healthcare provider as well, because he shouldn't be providing you more disease, or he shouldn't be spreading infections to you, right? Why? Because you are going to come in contact with that doctor, and he shouldn't be transmitting diseases from patient to patient, or he shouldn't also fall sick because of these patients coming again, and then the hospital which hires him should give a lot of medical leaves. So where there is immunization, that's vaccination records should be submitted. Personal health history, he should also be of a strong physical health status, that also will be checked. Explanation of any gaps in his work history, because he may be down behind the bars for some years for doing some criminal offense, and those would be his work gaps, right? So he has to give some explanation for the gaps as well, because that could be a genuine reason as well. He may be having some other work, he may be looking after his father's business, or he may be looking after bringing up a new business, or he would be doing some other studies, or she would have got married, she would have been a mother and nursing his child. So like that, so many things are there. So if there is anything genuine, then that can be explained. Hospital privilege and hospital affiliation, that's what are all the hospitals which he has worked in. Those hospitals are all proper hospitals, that's the check. And then CAQH enrollment. The CAQH stands for the Council of Affordable Quality Healthcare. CAQH is a not-for-profit collaborative alliance of the national level leading health plans and networks. So this is this enrollment is also checked on that. All this information must be backed with the copies of relevant documents and letter of recommendation and copy of your CV. So these are the things which you have to produce with the relevant documents, recommendation letters, and a copy of your CV. Then verification of receipt. Once the application has been submitted, it is recommended to follow up with an email or call to confirm the receipt and that is being reviewed. If required, the credentialing board may contact you for more information. It is important to provide such information promptly. When submitting an application, make sure you have copies of all documents. So this is the main things about credentialing. So I think you would have got a fair idea about US medical billing credentialing process. For those who are listening on podcast, if it's somewhat difficult, come to YouTube channel and watch this video. Search it as Joel John J YouTube channel, and you can go to the playlist and check for the US medical billing videos, or you can directly type it as US medical billing by Joel John J or US medical billing videos by Joel John J. If you still have difficulties, on the search filter, apply for playlist, definitely you'll get my playlist. And looking at my photo, you'll be able to identify. But on the broadcast, I wouldn't have given my photo. There'll be a different one. And soon on broadcast also, I'm going to give the customized thumbnail, so that will be easy for people to search as well. So those who are watching on YouTube, press the thumbs up icon, press the share and share it on all your social media. Share your valuable comment suggestion for improvement on all those. That's how this kind of videos have come in, and I want to come up with more and more creative based videos. So it's all on your hands. You have to come up and tell me that you have to change all this, and you have to present videos like that, so that I can give you more presentable videos wherein I can share you a lot of information. So, and also there won't be any kind of information misouts as well. So what do you think about this idea and this Zoom recording based video presentation and podcast as well? And that's the big advantage here. I don't know any software in which I can take out the audio alone from a video, or add a different audio to video. I have got something, but it's like you can erase and change the upload a music or something like that, or do a voiceover. Up to that level I have come up, but removing the audio from video, I haven't got any good you know apps or free softwares. If anyone knows that, please comment that as well on the comment box. It's like a general sharing of thought process. Okay friends, it's time to say bye, and wish you all the best in your career, in your job search, and in anything which you do on your future. And it's Joel Janjay signing off from you. Bye. And I have to stop the recording now. So oh sorry, it has come to chat. So here I have to go. I have to